My name is Robert Palmer. I'm the president and CEO of PotentiaMetrics. We're a data analytics firm, and we've developed outcomes and insight tools for cardiac surgery and cancer treatments. And we've done this in partnership with the medical school at Washington University in St. Louis and the Center for Outcomes Research at that institution. What we've developed as a firm is a platform of unique data. So going across the country and obtaining outcomes data from multiple institutions, today similar to ours, so top academic medical centers. In the future, additional platforms as well. And with this unique data, what we've developed are proprietary algorithms. So over the past decade, we've gained an in-depth expertise around understanding the implications of specific factors with respect to what are potential outcomes. So for instance, age, stage of disease, comorbidities with respect to what do we predict the outcomes would be on an individualized basis. So the tools that we've developed today are really around personalizing treatments for cardiac surgery and cancer. And the key product, a derivative of the work that we've done with the data and the algorithms we built, are actionable insights. So for the first time, we can empower patients with relevant information to outcomes of similar patients to them. Same thing from a clinician side. What treatment would work specifically best to the patient in front of you today, based upon what we believe is the largest longitudinal outcomes data set that exists. So what challenge are we solving? So today, for instance, in cancer, less than 5% of adult patients take part in clinical trials, and those that do are typically healthier, whiter, richer than those that show up at our institution. So that would be the too little information. The other would be now patients newly diagnosed with cancer. What treatment should I get? Now Google, and you get a torrent of information. Can you trust it? Can you understand it? Etc. So combating those with tools that we say is just right. So it's trusted, you know where it comes from, it's vetted, it's from institutions, it's personalized, it's relevant to you, and it's predictive. So one of the big challenges today, if you look at clinical study information, there's no indication of what the implications long-term of the treatment were going to be. So we provide this information to patients, physicians for the first time. So what are we doing with our tools? So providers are challenged with what are their outcomes. So we've uncovered for the first time how they're doing compared to similar institutions across the country. So East Coast institution versus West Coast versus Southern institutions. What are your outcomes on a risk-adjusted basis? It's really important for us to understand the risk indication, because the institution will frequently say, yes, but I'm getting sicker patients. So our tools adjust for that and allow the institutions to negotiate reimbursement rates with insurance companies, publish what their outcomes are, etc. And payers are very interested in who's providing the best outcomes. So best outcomes clinically, best outcomes from an economic perspective. Med tech companies, is there an ROI for the device? So I'm selling these devices. Historically, it's based upon, yes, we believe. We can actually prove from a clinical and economic perspective whether this device provides a lift. Our management team, so the vast majority of our team has been working together for over a decade. And again, I mentioned a partnership with the medical school at Washington University in St. Louis, as well as other institutions across the country. And just from a headline perspective, from cardiac surgery, Jim Cox, who created the Cox-Maze procedures, and Jay Piccarello, who developed the ACE27 comorbidity scoring index used internationally for cancer. So background on our company, we've been doing this since 2010, headquartered in Austin. We're a blend of companies, so we have our analytics team, 14 of us that work together building the models, and in partnership with the 7 people at the medical school. We believe we have the largest longitudinal outcomes data set that exists of cancer patients today, including detailed comorbidity information. And we've worked with 12 centers across the country, and today we're raising a round. Thank you very much.